Dear friends, we are going to see a very important topic, as it is affecting many ladies, and it is affecting the families and the countries at large, particularly African countries. Why do we say so? Let's see in very few moments. We look at um, these slides, the slides of this condition. Cervix is one of the organ which is going to be under discussion. Cervical cancer, cancer of the cervix. Let's see if we understand it. This condition is significantly causing serious problems, as we're going to see in the following few slides. It's not long presentation, because we need to subdivide into groups, into chapters. Otherwise, the topic would be too long. So let's see what is cervical cancer. We see this question, and others will be seen in the following presentations. So everything is going to be around this organ, the uterus, which has a cervix, and there is a vagina, and there is the other organs on left and right, which is ovaries and the fallopian tubes. But our focus is here on the cervix. With changes that take place in the cervix, then it causes a problem. What is cervical cancer? What is it by definition? Cervical cancer is one of the most common cancers that affect women's reproductive organ. We are just going to see what is cancer. So if this cancer is going to be affecting the reproductive organs of a female, what is cancer? We have the uterus here. When we see the pelvis, the woman standing, you see the bones, backbone, the iliac bone, the femur, right and left, and uterus is in between these bones. It is well protected, but there are some conditions which will invade this important organ, female organ. See the vagina here, the cervix is down here, and the uterus is here, and laterally, left and right, there are ovaries with the fallopian tube, and all of them are located below the umbilicus, the belly button, below. So, in the place called hypogastrium, or suprapubic, or retro, there is a pubis here, a bone which is here. So these organs are behind there. You see the pubic bone you are talking about? Behind there is the bladder, and behind the bladder there is uterus. So the bladder with the urethra, and behind the uterus, behind the bladder there is uterus on top, below there is a vagina, the vaginal canal, and behind there is rectum, which is a continuation of the intestines, large intestines. So these organs, it's very important to understand, because this proximity has a significance when you are talking about this cancer of the cervix. So these are the other organs that are very important. The attachment, they call them the ligament, broad ligament, which help to hang the uterus in place so that doesn't fall into the vagina. Otherwise, it would be a problem if it has no these parts supporting it. So this is cervix, which is going to be our point of interest, the lower part of the uterus. You can see the uterus. Now, the part we are talking about, when they enlarge it a little bit, we see the tissue which has cells, the glandular cells inside, and squamous cells towards the outside. So these cells, they go into a lot of changes if there is a predisposing factor, as we are going to see in a few slides. Now, to understand now the cancer of the cervix, let's understand the cell and the mechanism which will lead to the development of cancer. A normal cell will have a DNA in the nucleus inside. Then in the nucleus is the center inside. It's like a cell is like a balloon, but in which inside there are different organs inside, organelles. There is mitochondria, lysosomes, ribosomes, cytoplasm, and there are also nucleus. All these organelles will function together to make a living. So the unit will form tissues, tissues will form a systems together will form a full body, full like a human being. You can see now, if after the conception after the sperm from a man meet the ovum from the ovary of a female, two cells will form one in the beginning. So if they start dividing, two will give four, four will give eight, eight is 16, until they become many. Once they are many now, they start doing what we call differentiation. So this differentiation now will help to have different organs. There are cells that will make a heart, there are cells that will make the brain, there are cells that will make immune system, there are cells that will make bone skeletons. That's how it starts. Now, this multiplication of cells should be in orderly manner. If they are disorganized, it would cause a problem. So you can see now, if they are in orderly manner, connective tissue will give connective tissue. Cells that are coding, that are telling the cell to produce epithelial cells, the cell of the skin, they will do so. If it's a cell that have to produce muscle, it will produce a muscle. Same way as a cell that will produce what? Nervous system tissues, it will do so. We can see different types of cells. The cell that we find in the eye might not be the same as the one you find on the skin outside, or the cell that you find in the esophagus or in the trachea where we breathe. They might be different from cells that we find in the intestine. So that's how cells work after they divide in a normal way. So if they divide now in abnormal way, let's see, one cell is giving it 2, and another one is giving it 2. So in normal circumstances, a normal cell should give a normal cell. Another normal cell should give another normal cell. But for some reasons, whether viruses, whether other infections, whether radiation, different reasons, whether you are exposed to other chemicals, chemicals that would destroy or ruin the DNA of the cell. So it will start now fabricating faulty cells. And these faulty cells, they are the ones which will produce cancer. These faulty cells, they start coding very strange cells. And the danger with these cells, they multiply on a very high speed. If this one would give like 2 babies in 2 hours, just an example, this one in 2 hours will give 10. So that's an example to show how much a faulty cell will multiply in a very high speed. And once they are multiplied in that high speed, it creates what we call tumors. So now the body has to start fighting, because the body will detect that these cells are not normal. It will start to fight it. That's how it will start sending the antibodies, and where the fight is, we will see a swelling. That's why we will start seeing adenopathies, the swelling of the lymph nodes. And sometimes the cells are trying to run and go to get located, to be located in other places. The danger now with this cancer of the cervix that you're talking about is that every year we record 500,000 women worldwide who have cancer of the cervix. It's 500,000 every year they are recorded, while 280,000 of these women will die. Cancer will kill them. This shows how much this cancer is very serious. We cannot take it light. It is causing a disaster into many families. 80% of these women are in the developing countries with low income, the poorest regions of Africa, mainly Africa, sub-Saharan Africa. Yes, Asia, we have some few countries in Asia, but mainly in sub-Saharan Africa and Latin America, but the majority are in our region. Should we keep quiet and not talk about it? After seeing this, you can check internet, go to World Health Organization website. These informations are there. Please, let's wake up together. Let's work together. I'm asking you, colleagues, friends, health professionals, what intervention, what can you do to make a difference in the lives of women who are innocent, who are dying without knowing because they have no information? That's the only reason. They have no information. If they have enough information, they were educated, wouldn't have these numbers. I kindly ask you, colleagues, friends, to try the best you can to make a difference. We ask you politicians to look with a open eye into these problems. These maps are not written, put not here for a reason. For there is no, we can't say that was put without a reason. No, the maps are done to show us, then to do intervention. We can see the more it is red, more we have many cases of cancer of the cervix, more we have deaths, and we understand the burden it causes. You can see if you go to, this is a Morocco, Egypt, and Algeria, the top countries, they don't have many cases. Going to Israel, going to some Europe, we go to North America, Canada, we don't have many cases. But to come to South America, come to Africa, it's a disaster in sub-Saharan Africa. Dear friends, I hope the message is clear. This is an introduction to the presentation, part of the definition and introduction. Let's go in a few slides that are coming to understand now the cause, the root cause of this cancer of the cervix, the complication it will cause. Thank you for following up this introduction. We hope the following is going to be useful to you as well. Thank you.